All right, maybe this sounds like you. Are you living in any kind of agonizing pain or perhaps taking addictive pain medications? Well, guess what? You can take control of your life with alternative and unique approaches. With us now on how to do that is Dr. Neil Ellis with Physician Partners of America. Dr. Ellis, thank you for joining us. This is, I think, a problem of epidemic proportions that we're talking about here in terms of pain and more to the point, chronic pain. But before we get to how Physician Partners of America deals with pain, let's talk about you. What is your background and how did you get to this point where you're helping people with their pain problems?
So I kind of have a long history of this. I ended up coming to the United States to do marine biology. And while doing that degree, I kind of felt like I wanted to go into medicine. At that time, my sister was having all kinds of health issues, and she was treated with Chinese medicine and was very successful with that. And so even though I felt like I wanted to do traditional medicine, I felt like there was no other time I would really explore Chinese medicine. So I ended up doing a 4-year master's in that, and then a 1-year apprenticeship in China. And following that, decided to use that kind of as a backdrop to getting into traditional Western medicine. And then went to medical school and ended up doing my residency in anesthesia in Gainesville. And then we love Tampa, so we moved here. While in Gainesville, I did a fellowship in interventional pain medicine, which is an anesthesia fellowship where it kind of takes us outside of the traditional anesthesiologist where you're at the head of the bed and making sure the patient is doing well through the surgery, to where you're almost more in the surgical position and you're the one kind of doing procedures and interventions on the actual patient.
So with all this vast and very interesting background, here you are now at Physician Partners of America. And what kinds of people come in to see you? What kind of chronic pain are they suffering from? And how are they dealing with it? And why is your way a better way in terms of being unique?
So the traditional sort of pain model was fundamentally spine-based. So people who have issues with neck and back issues and whether or not that radiated down a leg or down an arm. Some new stuff is coming on the horizon where we can be more targeted, and we're actually doing peripheral issues too, maybe like diabetic neuropathy or hernia pain or stuff that is outside of the traditional spinal pain. But for sure the majority of what we do is based on spine stuff.
I mean, when you have chronic pain, and if any of you watching have chronic pain, you know that it just is completely debilitating. And it really affects every part of your life, doesn't it? So why should people come and seek out this alternative approach?
So one of the overarching issues in pain treatment at all is opioid addiction, opioid problems, that type of element.
People are just taking too many, they're being prescribed too many.
For sure, you know, and I think that it's unfortunate, but we didn't really acknowledge how bad the problem was. And physicians felt like they were doing the right thing, trying to help somebody, but this has kind of maybe escalated to a point where it's problematic.
Yeah.
You know, and then the other thing is that pain, I think that people don't really understand how much it can impact an entire life in a family, where you can lose your job, or you can lose a spouse, or you become a bad parent, or you become mental health issues. Like one single health issue can have an overarching effect on your whole life.
All right, well, I'll tell you what, it's such an epidemic, as I mentioned, but there is help, and if you want to learn more, all you have to do is call Dr. Ellis's office at the number right there on your screen, 813-437-1726, or visit PPOAmedical.com. And Dr. Neil Ellis, thank you so much for coming by. Really appreciate it. All right, and Daytime will be right back. Stay with us.